Welcome back. The deadly flooding in Waverly could have some significant impacts on the victims there. And I'm now joined by Nathan Miller of Volunteer Behavioral Healthcare System. Nathan, good morning. We appreciate you being here to discuss this very important topic. I want to start by just asking you what the mental toll is like. What are the mental health ramifications and impacts on the people who experience this flooding?
Well, and it's such a huge trauma. You know, it's such a big event that happened in these areas. You know, so many people affected, so many lives lost, property affected. Even if you were in the area and affected, you had some type of loss.
Yeah.
So, and that ranged from, like I said, you know, losing someone. That's going to be the biggest thing to overcome for a lot of families and a lot of friends in those areas, because they may be suffering grief. You know, right now, others will be suffering from depression. Some will suffer from anxiety, and some will suffer from guilt. And some folks may have a little bit of everything, to be honest with you. You know, with guilt, you know, you have families, we've heard stories of people who were actually holding on to their loved ones and were not able to hang on to them through the flood, and then they, you know, were one of the fatalities, unfortunately. So, you know, those things, you know, tend to haunt people for a long time and for the rest of their life.
You know, that's what I was going to ask you next, because we're looking at the images, and whenever we see them, it's so heartbreaking. It's so stunning to see just the destruction and the devastation. Going forward, if other natural disaster events, other severe weather events happen, could that also be a trigger for a lot of these people as well? It
could. You know, weather forecast, severe rain forecast, tornado warnings, any type of thing can set off those triggers. It may be, you know, that some folks, even, you know, after this flooding, they don't want to go to their swimming hole anymore. You know, they don't want to go swimming. They don't want to go to a certain place that something, you know, traumatic may have happened to them during the flood. You know, they were at a store or whatnot, and that's where they were trapped. Yes, triggers, nightmares. There's a lot of things that go along with this. People will have long-term, could have nightmares. They could have vivid flashbacks. They will avoid places that they've been.
Wow.
You know, when the traumas occurred. So it's something that some folks will deal with for years and months to come. And some people, the trauma may not affect them right away. You know, they may be suffering through the grief and some of the issues right now, but as time goes on, it may develop into more serious issues for them that they will continue to have to deal with.
And that brings me to the next question. What are the resources that are available for these people? How can the Volunteer Behavioral Health Care System and others help them to recover from this mentally?
Well, of course, you know, the big resource is going to be counseling for these folks. As with any kind of trauma that people go through, everybody, you know, is affected to a varied degree. Some folks are not going to be affected at all, which I don't think this case is going to be, but others are affected mildly and some are affected severely. So those resources are going to depend on exactly how much they're affected. But of course, counseling, medication services, care management services, and those type of things, most of those are available through local mental health centers. You know, whether that's, you know, Volunteer Behavioral Health, or that's, you know, one of the other agencies throughout the state. A lot of times those community mental health centers also have state-funded programs or grants that are able to help people, you know, if they don't have insurance. So those are good things to come up with too. So just because they think they don't have insurance and they may not be able to pay, doesn't mean that they probably don't need to call, because they do. Just call and find out what is out there for them.
And I'm so glad that we're sharing this information with people, and we have these resources. We'll have them posted to our website as well. Thank you so much for talking about this, Nathan. We appreciate it.
Thank you.
All right.